Good morning, everyone. This is Megan Rogers with Indiana SHIP, the State Health Insurance Program. And I am here for our Medicare What to Know Wednesday. I forgot what day it was. And we are here to do a presentation on Medicare and mental health. Good morning, Susan.
Good morning, Megan.
So Susan has prepared a wonderful presentation for us on mental health and Medicare. And we know that our mental health is just as important as our physical health. So Susan, I'm going to pass it over to you to let us know how we can treat our mental health with Medicare. Before I do that, though, feel free to chat in your questions in the chat box for Susan. I will be monitoring those throughout the presentation.
Thank you, Megan, and thanks everybody for joining us this morning. I believe May is Mental Health Month, but we're going to carve out how Medicare covers mental health services. First, let's talk about statistics. Statistics can be boring, but it does illustrate the need for insurance coverage for mental health conditions. So probably most people don't know that for folks 60 years old and older, 15% of those have a mental health diagnosis. And in 2021, which are our latest statistics that we're referencing, almost 30% of Hoosiers had anxiety and depression and hadn't received any counseling for that. 1 in 5 adults in the United States live with a mental illness, and that's almost 60 million people in 2021. And I would imagine those numbers have not decreased since then. And it is one mental illness, depression, is the most prevalent mental health diagnosis among older adults. So here we see an illustration with some additional information. 60% of adults with a mental illness did not receive any mental health services in the year prior. 60%, more than half, have the illness and didn't get treatment for it. Almost half of kids and youth in this category are between ages 8 and 15, didn't receive any mental health services in the prior year. And as many disease processes are more prevalent, African Americans and Hispanic Americans used mental health services at about half the rate of whites in the past year, and Asian Americans about a third of the rate. So our people of color, Americans, are not receiving mental health services like Caucasians are. There's lots of ways you can get help. A lot of people just start with their doctor, with their primary care physician. They have your chart. They know things about you. It's okay to talk to them about mental health as well. A lot of people use our friends. We can connect with other people with or without mental illness diagnoses. Many people do suffer depression, as we saw on the previous slide. So probably if you've got 5 friends, probably close to half of those have had or have depression or another mental illness. And it's important that we really make an effort to learn more about mental illness. If we don't have a mental illness, then it's likely that someone in our family does. There's a really good resource to learn about mental illness, and that's NAMI, N-A-M-I, the National Association for Mental Illness.org. They have a terrific website. I'm sure you have a local chapter in your area, and you can see how you can become involved and increase your knowledge about mental illness and treatments in general. Now let's hone in on our main topic today, and that's how Medicare covers mental health treatment. So most of our mental health treatment will fall under Part B, as does most of our medical treatment. Part B covers all the outpatient stuff. So going to the doctor, labs and tests, things like that, that all comes under Part B of Medicare. And Medicare beneficiaries are allowed to receive a depression screening each year. Oftentimes, this coincides with their annual wellness visit. There are some depression screen questions there that your doctor will ask you, or your nurse practitioner, whoever you see for your annual wellness visit, and they're screening you for depression. Part B also covers, just like going to a medical doctor, it can cover psychiatric care, going to your appointments to meet with your mental health professional. It can cover family counseling if it's the main purpose is to help you with your treatment and you being the Medicare beneficiary. It covers the testing. Sometimes it's hard to diagnose a mental illness, just like medical conditions. And so you might have to go through several tests for them to really narrow it down to make a good treatment plan for you. You can have a full psychiatric evaluation under Part B as an outpatient, and it can help you learn how to manage your medications. Often that is a critical component of mental health treatment, just like medical health. Sometimes Part B even covers medicines. So it wouldn't be the medicines that you get filled at the pharmacy and you go home and put them in your pill reminder box and take them every day. These could be things like injections. Oftentimes people with mental health diagnoses receive their medicine by injection. It's usually a long-lasting thing. Um, if you get those as an outpatient, of course, that comes under Part B and not D for drugs. Part B covers the diagnostic tests. It covers something called partial hospitalization. And this is for folks who don't need an inpatient hospitalization to address their psychiatric needs. But what works best for them and their conditions is to go to a center or a group, an office. For usually it's for the bulk of the day. And so then they go home at night, and that's called partial hospitalization. And since that's considered outpatient, it falls under Part B of Medicare. And of course, the preventive services like the depression screen, um, like the annual wellness visit, those all come under Part B. Here's a slide that we've used several times in different presentations because we really like to promote all the terrific preventive health coverage you get as a Medicare beneficiary. But highlighted here are the things that we've already referenced because they align with mental health concerns. One of the things that Medicare Part B covers that might lead to a mental health issue is alcohol abuse. Now, under Part B, generally along the lines with your annual wellness visit, you will have an alcohol screen. And if you need counseling, then you can get that too. We've already talked about depression screens, and this can occur, as we've said before, during your annual wellness visit, or if you're new to Medicare the first 12 months, you get a welcome to Medicare visit, and these things will be addressed. There's all kinds of different providers for mental health services and mental health care. Unfortunately, what we've seen is sometimes it's kind of hard to find one that can take you as a patient immediately. So Medicare fairly recently has broadened who can provide mental health services under Medicare. Psychiatrists, of course, or other medical doctors, clinical psychologists, clinical social workers, clinical nurse specialists, nurse practitioners and physician's assistants can all be your provider under the Medicare mental health benefit. And those are professions who have some fairly intense studies and experience around mental health treatment. Now remember, when you go to a provider, make sure that they accept what Medicare assigns to that service. And we're talking payments. So providers can charge you a little extra if they don't accept Medicare assignment, meaning what Medicare pays for a service. But if you go to a provider, a Medicare provider who accepts Medicare assignment, then these services are no charge to you. Outside, of course, your Part B annual deductible and your 20% copay for most things. Where can you receive mental health services? Well, in various types of settings. We've already talked about partial hospitalization, being, you have your treatment all day and then you go home in the evening. But if you need therapy kinds of visits, they can be in a doctor's office or other healthcare provider's office, one of those healthcare providers we saw on the previous screen. You can go to a hospital outpatient department, or you can go to the community mental health center. Most communities do have a mental health center, and they could be concentrating on just mental health. They might mix in some medical stuff in there, but you can always easily find out where your local community mental health center is. Now, Medicare also covers inpatient mental health treatment, and since it's inpatient, it comes under Part A of Medicare. But you have to be admitted as a patient. You can get services in a regular hospital or in a psychiatric hospital, and there's no limit to the number of benefit periods you can have. Remember, Part A has those silly things called the benefit periods, and for each new benefit period, you are subject to the benefit period deductible. Those can occur multiple times during the year. But you can continue to get care, all the care you need in a general hospital. However, if you're admitted to a psychiatric hospital, Part A pays for up to 190 days of inpatient psychiatric hospital services during your whole lifetime. So there is definitely a difference. I hope this will change one day, but currently these are the rules around Medicare inpatient. General hospital versus a psychiatric hospital. Psychiatric hospitals, as we've seen here and just said, there is a limit to the days of service you can receive. Here's our information about how to find out more about mental health. We have a brochure that we could be happy to send you, and we also have some publications from the federal government. Just give us a call and ask for that stuff, and we're happy to stick it in the mail for you. You can call us at our toll-free number listed here. You can visit us online, medicare.in.gov. We know you're following us on Facebook because you're joining us on our Facebook Live programs, but we're also on all those other social media channels. Megan, that's the end of my presentation. Can you tell us what's coming up yet this month? And then we're going to peek into the future a bit.
Yes, I would be happy to. Thank you, Susan. And thank you for a wonderful presentation on Medicare and mental health. So we have one more live in May. Next Monday, we are going to talk about end-stage renal disease, Medicare. If you are diagnosed with ESRD, and you're not on Medicare due to age or disability, you can get Medicare for end-stage renal disease. So we are going to let you know how that works and what you can get and not get through this Medicare. And then in June, we're going to start the month off with talking about cataract coverage under Medicare. We are going to meet a partner agency for What to Know Wednesday. And then we're going to wrap up the month with common pitfalls with your Medicare. We also in June have a new to Medicare webinar. Whether you're new to Medicare or old to Medicare, you can hop on and learn about all the parts, when you might need Medicare if you're working, or when you can delay it, if you're working and have employer insurance, and you can ask Susan and I questions about Medicare. You do have to register through Eventbrite. We do have an event listed on Facebook, and it has the link to take you to Eventbrite to register. When you register, you will get the Zoom link for June 18th at 6 p.m. Eastern. All right. Well, thank you everyone for tuning in. You can chat in the chat box, even if you're watching the recording. Susan and I monitor those, and we will answer your question as soon as we see it. We will see everyone back here next. Oh, actually, Susan, we're going to be here tomorrow. I almost forgot. We have a lunch and learn tomorrow at 12 o'clock Eastern. We're going to have a special guest with us, and we're going to talk about hospice care and Medicare. So you will see us sooner than Monday. Woo-hoo. All right, see everyone tomorrow. Bye.